Hi everyone, Tom again, and welcome to the 8th Discovery Module on Age-Related Macular Degeneration from VisionQuest. In our last session, we learned about the role of low vision assessment, available aids, and several adaptive tips that may greatly enhance quality of life for those struggling with AMD. In this module, we'll consider an often overlooked element of care. Since there's usually a person hooked up to the eye or eyes being treated, we need to navigate beyond the retina. Age-related macular degeneration represents a particularly complex psychological situation, as I'm sure you know. As if the fear of vision loss isn't enough, the variable and somewhat unpredictable course of AMD typically generates significant stress and anxiety. It's vitally important to understand that this applies to both patients and their caregivers. Kim Darden, a certified physician assistant specializing in retinal care, recently visited with Dr. Paul White. Let's listen in.
Dr. White, can you tell me, are there predictable patient reactions when a patient's been given a diagnosis of a chronic disease, or in our case, a vision-threatening disease?
Yeah, there are. Probably the most predictable one is some form of denial. Not that they deny that anything is going on, but maybe the severity of it. They want to minimize how bad it is, or that it's not going to get worse, or they're going to be fine. And they sort of have a hope that there's still some solution out there that maybe hasn't been found. So that's sort of the first reaction that most of us go through. And then after that, after they sort of dealing with the reality of what's going on, there's a variety of reactions, sort of depending almost on the sort of personality style. Some people get anxious and worry about all different kinds of things and how this is going to affect their life and the future and the family. Some people get sad and maybe depressed. Some people get angry, and feel like this isn't fair and why me? And so there's all of those issues that they're sort of grappling with. How is this going to impact my life, and especially in the future, because they can sort of deal with day to day, but as they think about the future, it's harder.
When she was starting to face the possibility that she was going blind, I could see a significant change in presentation, and it scared her. She was scared to death. But again, I would say that the treatments have done wonders. She was really headed down a pretty negative path, and I at least felt like she was headed for blindness, at least partial, and that's been reversed, and she's actually doing quite well.
And is there a point where they come to acceptance on the chronic disease?
Well, it depends on the person, and also on the data that you get. I mean, it's helpful to have accurate information, and it's also helpful to have that from different people or sources, so that if you're only hearing information from your doctor, that's different than if you're hearing the same information from your doctor, from a friend, from a family member, from a TV program, whatever. Then you start saying, okay, it's not just the doctor saying this, but there's things that are true and accepted all around.
Can you explain to me how a patient's depression can affect their chronic disease?
Yeah, if we think about depression, really, it's sadness, but more than that. A hallmark characteristic of depression is hopelessness. It's that there's no hope that things are going to be better or whatever. And so when we get depressed, again, different people react in different ways. Some people have a hard time sleeping, which obviously interferes with, your physiology. Sure. Some people want to sleep more. Some people get agitated. Some people, withdraw socially. And also they start to just sort of withdraw as a person. They sort of quit living life even though they're living. And so what happens then is they may not eat well, they may not sleep well, drink enough, get exercise, and all those kinds of things can play into how their body's dealing with the illness and can make it worse and clearly exacerbate the symptoms so that the physical part looks worse than maybe it actually is.
Is there a way to predict how long a patient might remain depressed?
Yes and no. Yes, in the sense that if someone's been depressed before in their lifetime, they're more at risk for becoming depressed again. But aside from that, there aren't necessarily certain personality characteristics that would predict it. The biggest predictor really is sort of lifestyle issues. We know that certain things that we do are more likely to make us depressed. So if we withdraw socially, we start to think incorrectly, and that leads to depression. Obviously, if we start to sleep a lot and become passive in other ways, it leads to that. But it's more like, and I think the bigger issue is not depression, but sort of going from normal sadness to deep depression. And the things that really impact that are social interaction and also thinking clearly and thinking accurately about your situation.
At what point do you think a patient struggling with macular degeneration or AMD should seek professional help for their depression?
It really depends on how much interference it has in their daily life. I mean, if they're starting to not function in daily life, not interact with people, not get out of bed, not do anything that they used to do, then you need to take a look at that. It's tough because sometimes other people see the depression first and see it more seriously than the patient does. And so that can be a challenge. But clearly, a clear warning sign is if you start to think about hurting yourself or wanting to take your life, you need to get some help pretty quick. But besides that, it has to do with how much is this really impacting my normal daily life routine and living sequence.
Are there any over-the-counter vitamins or drugs that can help treat depression?
Well, that's a bit of a sticky question in that some people would say yes and some people would say no. Yeah. I think the research that's done with groups of people that are depressed show that over-the-counter vitamins and nutritional supplements don't have that much impact. I mean, clearly good health and nutrition is important. There's no doubt about that. But St. John's wort and some other kinds of things for a group of people that are depressed isn't going to impact them that significantly. Fortunately, there are medications that really can help and are quite safe that can help us. They don't make you feel good, but they make you feel less bad. And they help you sort of be able to get out of sort of the trough and be able to think more clearly. And they can be quite effective. And it doesn't have to be forever. It might be for a period of time until you get sort of thinking clearly again.
What professional options are available for patients with chronic disease and that's maybe suffering from depression?
Well, there are a number of options. I think almost always the best starting point is with your family physician, your primary care physician, because they know the whole picture, hopefully, and you know them well. And then they can assess the situation and sort of see what resource would be best for you as a patient, whether or not that's going to a counselor to help talk through what the depression is about, or whether or not it may be treatment by medication. Sometimes there needs to be involvement of another specialist, of a physician, if you're taking medication for your disease condition. And then there can be other helpful resources as far as family counselors who deal with the challenges of the family being involved and or wanting to be involved, and how that interrelates with the patient and what they want, and be able to work out those issues.
Are there any references that you would recommend for the patient or their caregivers to review, such as books or articles that might give them more information on how to manage and cope with their depression?
There are. In fact, it's almost overwhelming how much information is out there. So I tend to have a couple of favorite books that I've found helpful over the years. One is sort of a classic. It's called Feeling Good. It's sort of a funky title, but by a guy named David Burns, B-U-R-N-S. And it's a really solid approach to how to take control of your thoughts and your thinking patterns to help you get away from anxiety or depression. And another one that's related to that is called The Lies We Believe by Chris Thurman, Thurman. And again, it's sort of looking at how we distort things in our mind that get us off track, and both are really helpful.
What about support groups? Do you find them to be helpful?
Well, it actually depends on the patient, right? Because some people like to hear and interact with others and hear their stories and so forth, and some people are very introverted and they're private, and going to a support group would actually be sort of anxiety producing. So, and also not only the person, but sort of stage of life or the disease, that at some points they may be more open to it than others. But generally speaking, if a person's interested in it, I think support groups, especially around the specific disease or medical issue, are really helpful because they help give you reality-based feedback of these symptoms are not just unique to me, other people are experiencing it. And not just the symptoms, but other challenges in life about the challenges of independence versus being dependent on people for things, and how to manage that, and how to relate to your adult children when they are trying to tell you what to do, and those kinds of things. So it's helpful to hear other people's stories, partly just for what we call a normative experience, to help you understand that this is normal. And then also they can provide sometimes some helpful hints or solutions that might be helpful. Lots of times they're very unique to their situation, but it's nice. And the other nice part really is that you have the opportunity to build some new friendships in the stage of life that it's often difficult. And hopefully there's somebody in there that's cheerful and brings some humor to the situation too.
In our practice, we really rely a lot on the caregiver to help make treatment decisions, and they play an intimate role in the overall care of the patient. How can the caregiver themselves help the patient remain positive?
Well, to be honest, ultimately they can't. I mean, each person's mental state and mood is their own responsibility. And so we have to learn to accept that. But there are things that we can do to influence it. And so just wanted to draw that distinction. Sure. We can't make somebody feel good, right? One is to really, I think the first thing is to listen and try to hear what's important to the patient. Lots of times caregivers come in with assumptions about what the patient needs or wants, especially because they're often close. I mean, they're family members lots of times. And so there's sort of that mind reading that can go on. And so I think it's helpful to listen. Sometimes people just need to talk. But sometimes some people don't want to talk. And we need to hear that if they just want some space and alone time, that's okay. And I think a nice question is to say, what would be helpful that would be encouraging to you? What would be something that you would enjoy doing today or this week? Some people will be able to tell you, others won't. And so sometimes you have to think back in the past of their life of what kinds of things, either in the past or recently, did they enjoy doing, whether that's, watching a certain kind of TV show or movie or going shopping and those kinds of things, and try to build those into their lives. So, you think about sort of a math equation, you're trying to add more positives, and so different kinds of experiences that they enjoy.
Are there any specific things a caregiver shouldn't do?
Yes, there are. Although caregivers almost always mean well, sometimes we overstep our boundaries, and we either tell people what they are thinking and feeling, even though they may disagree, or that what we think they should do, and try to force them to do it. And that creates problems that I think God made us all to be beings of choice. And whenever we feel controlled, we rebel, even when it's not good for us. And so I think we don't want to try to make people do things, but always give them a matter of choice. And I think also don't discount or argue with what they're feeling. In other words, telling them, you don't really feel that way. No, if they say they feel that way, you should go with that. Otherwise, it's really sort of disrespectful as a person. So I think listening and giving them choices is a good way to go.
How valuable is just being there for the patient?
It can be crucial. And sometimes, especially when people are struggling, they're not always either aware of their needs or desires or able to communicate them. And it's not dissimilar to hanging out with your kids when they're younger or they're adolescents. They don't tell you that they want time, but you got to hang out and be there when they do want to talk. And I'm not equating, patients with adolescents, but just the theme is the same, that sometimes people just need you to be there. And for some people, that just communicates care. For others, it provides the opportunity for them to talk and share when they're ready to. And those can be fairly narrow windows of time. So overall, I think it can be extremely important. But on the other hand, there are some people that they need some alone time, and you need to honor that as well.
Is there anything that you think the caregiver could be at risk at personally in managing someone with a chronic disease or helping take care of someone who has macular degeneration?
Sure. I mean, just like the patient has to cope with this new reality in their life that they've come to discover, so does the caregiver, because it has both direct and indirect impact on their life. Obviously, the biggest risk is burnout.
Right.
And burnout, really, if you think about it, it's sort of like giving and giving when you don't have any more to give. It's sort of like the well is dry and there's no water there, and you keep trying to give. And what happens then is they then become at risk for becoming depressed, for being angry, either with the patient or with the situation, or even to the point of physical exhaustion and physical illness for themselves. They can put themselves at risk by continuing to give. So it's really important for caregivers to have some things in place to help them monitor how they're doing.
How can a caregiver find balance between caring for their patient or their loved one and caring for themselves?
Ultimately, it comes down to wisdom.
Yeah.
It's knowing when to give, when you've given enough, what you can do and what you can't do. I think for caregivers, often there's a sense of wanting to do as much as you can, but we all have limitations, right? I mean, we can't heal that person's physical condition. We can't make them feel better just by ourselves. And so sometimes we take on loads that aren't ours. There's a great book actually called Boundaries by John Townsend and Henry Cloud that helps us sort of determine what's my responsibility and what's other people's. I think a key issue for caregivers is to know which way you tend to go historically. I mean, that you tend to maybe not give enough. There's some people that are actually that way. Most people in the caregiver role don't fit there. And then the people that give too much. And then I think a key point is to build in a feedback system, some people that you trust their judgment, and they can say, you need to take a break, or you need a vacation, or we need to get you some help, so that often our sense of that is late in the game. And so we need to build in some people that we can trust so that they can tell us when they think we probably need to take care of ourselves.
Dealing with chronic disease requires a multifaceted team approach. How can a patient help themselves when dealing with their different physicians or doctors?
Great question, because it's so critical that your doctor and other professionals have information to know what's going on with you or who you're seeing. And so I think one is to try to be open and honest. Withholding information doesn't help, even if it's either embarrassing information or you just feel badly that you went and consulted with another doctor or something like that. So being open. I think the other thing is most of us, when we're dealing with a health issue, have periods of time, at least, when we're not thinking real clearly and we forget stuff.
Yeah.
And so it's helpful to make a list ahead of time of the topics and issues that you want to talk with your doctor, and also other professionals or tests or medications or over-the-counter supplements you're taking, so they have full knowledge of that. And then know what you want to ask your doctor. Go almost in with a list of questions. Say, this is what I'd like to find out, and take control of that, so that they don't have to read your mind about what you want to know, what you want to find out. And you're really the patient, you're the focus, and so you should take control of that time and say, I'd like to know these things. And then it's going to be helpful for either you to write it down, somebody that's with you in the appointment to write it down, or to ask the doctor to get you a written copy of what they've said, because lots of times we're anxious in those appointments, and when we're anxious, we don't remember things well. Yeah. And so to get some form of written document of what they're recommending or what their answers are, so that both you can remember it and you can also communicate it clearly to others, whether it's family members or other doctors.
I think it's really important to humanize the process, because it can be so overwhelming. And I think another piece that's really important is listening, 2 sets of ears. And I would take notes and then, write or call a report into one of her faraway daughters. This is what her eye pressure was. This is how she experienced the visit today. This is what's going on.
Dr. White, are there any family dynamics that can play a role in taking care of a patient with a chronic disease such as macular degeneration?
Yeah, there are. And it can play itself out in a couple of ways. One is with the spouse. A husband or wife who has their spouse that has a disease really is going through a lot of issues on their own. I mean, they're sort of in shock. They're having to deal with their own fears and anxieties. And I think a practical point about that is that I think it's probably not wise to assume that just because a spouse is there in an appointment with a doctor, that they're hearing things clearly too and will remember them. And so sort of that point about writing things down and having written communication is really important, because they're thinking and having anxiety, and so they're not going to remember things as well. And that they have their own issues that they're having to deal with, and that can interface with what's going on. I think as common as that is the adult-child relationship, who often is the caregiver. And that becomes sort of weird in some ways for both the parent and the child, because they're an adult, the child is, but they've had this parent-child relationship before, and in some ways and in some cases that role's changed a little bit as far as giving care and maybe overseeing some aspects of life. And so there's some really important issues to pay attention to that. And like we said earlier, it's about sort of honoring choices for the patient. And lots of times I can tell you that adult children caregivers often don't feel sort of appreciated enough, and that they're giving a lot, and sometimes they take some grief from the patient, that the patient treats them, when they're irritable or not feeling well, and they'll snap at them, and so that can become an issue. And so it's really important for the caregiver and the adult child to have a support system and to be able to deal with that, and if possible, sort of have a tag team relationship with other family members or caregivers so that they're not carrying the full load.
You've given us some excellent information today. Are there any final thoughts that you have?
Dealing with a degenerative disease is difficult. And I think we need to accept that, or say, this is not just light stuff. This is tough. Sure. And but at the same time, there's still life. There's still hope. There's still relationships. And regardless of what the pathway may look like out further, is to try to enjoy every day to the fullest you can and really appreciate those around you. And that makes life full.
Excellent. Thank you.
My pleasure.
So, what we've learned together is that the priceless person attached to an eye or eyes with age-related macular degeneration must be considered as a whole. We all respond to disease with predictable but manageable feelings. Attention to the mental well-being and the psychologic needs of both patients and caregivers is so very important. A caregiver can't provide care if his or her own health is unnecessarily compromised. Remember that you are not alone on this journey from A, diagnosis, to be best outcome. And people that care intimately about you are ready to assist. Just don't navigate this alone. There's a reason we fly in formation. In Discovery Module number 9, we'll take an in-depth look at what a patient can really expect during the course of individualized diagnosis and in-office treatment for AMD. So make sure to join us, and remember, keep a steady heading and stay the course.